Welcome to another episode of Becoming Limitless. Today I'm joined by the awesome Dr. Anna Sepiolo. We're going to be talking a little bit about menopause and andropause. There are going to be some questions, some clarifications, and just simple hacks on how to approach it naturally. Welcome, Dr. Anna.
Thank
so
you,
nice to
Elias.
have you.
Thank you for having me.
It's what you do is amazing. You have a clinic in Jumeirah, correct?
Yes, I have a clinic in Jumeirah, EV clinic, when I take care about the woman's health.
Very good, awesome. And your specialty is functional medicine for women, correct?
So I'm board certified gynecologist with 30 years of professional experience.
Awesome.
And since approximately 15 years, I focus on the functional gynecology.
Yeah, amazing. So I grew up in a family of women. I'm the only boy in the family. And I was always kind of exposed to all of the things that my sisters and my mother went through as a child, and as you know, I was the youngest in the family too. So I always feel maybe a little bit more informed than most other men that are in my circles when it comes to the subject of fertility or menstrual cycles or premenopause, menopause, etc. And now obviously part of what I do in my programs, it comes up more often for both women and for men. So prior to the show, I did a little research. And I was looking at how, if there are any other mammals that actually go through menopause too. And I discovered that orcas, whales, go through also menopause.
Oh, really?
Yeah, isn't it awesome?
They cycle apparently,
Yeah.
yes.
And then the only time that the oldest orca becomes the leader of the pod, that's what's called like the group of whales, is after menopause. So they become then the ones that lead the pod into all the right places and help nurture the young, which is something that we share with them as a species. Because the research and my general information on this is that after menopause is truly when women become proper nurturers for the next generation. So what do you think?
Yes,
about
apparently in the ancient ages, the menopausal woman was the wisdom one.
Yes.
So what's the leader one?
Yes.
Now we think menopause is something to hide, something to not talk about. That beautiful woman has to be thin, fertile, and wrinkle-free.
Right. I mean, it's just one of the cycles of life, right?
That's the normal cycle in life, which it's inevitable. So it will happen to every woman. It will happen around the age of 50, 52. Mm-hmm. But it does not mean that's the end. It's just a new beginning. Menopause is rebirth. So what I'm trying to teach my patient, do not give up. That's the time when you can blossom and nourish, and you can flower. It's the time when the children are grown up, when work is stabilized, and it's time to focus on your health, on yourself.
It's just another chapter, right? And every chapter is special in its own right.
It's very important chapter because if we miss it, we can really struggle a lot. Because menopause, it means it's a pause of the hormone production. So we need to take care about the hormones a little bit earlier. We need to take care about your health a little bit earlier to go through the menopause in a smooth way.
It's nature's way for birth control, correct?
Yes, so we have to be fertile, and then no longer to be fertile, but to be leader of the team.
Right. And there are certain symptoms that women need to look out for and strengthen, right?
Well, apparently the symptoms of perimenopause can start 5, 10 years before.
Oh, I see.
So women around age of 35, 40 can experience sleepless nights, PMS, breast tenderness, irritability, mood swings, weight gain around abdomen, intolerance to stress.
I see.
So listen to your body. You need to listen to your cycle. You need to watch the cycle. If you go to gynecologist, for example, and gynecologist is saying, by the way, you have uterine fibroids, you have breast cyst, it does not mean that everything is good with you. It means your hormones are starting to fluctuate. It means you produce too much of other hormone, not enough of another one, or you just don't detoxify. It means your liver is tired. Maybe you live in the toxic environment. So it's a lot of things to watch, but women should watch the symptoms.
Yeah, I think it's great advice. And the bodies are always telling us something.
Yes,
They're always
listen.
giving us signals, right?
Listen to your
Now,
body.
a quick question for you, because I have quite a few people that I work with that suffer from PCOS, for example, and other hormonal imbalances or issues with cycles. Now, can menopause happen at an earlier age?
I just was about to ask
Yeah?
that thing, like what we spoke earlier.
Yeah, right. Yeah.
Like I've heard some women might have a menopause before they turn 30 even.
Yes, apparently 1% of women will enter menopause before 40. We called it premature ovarian failure, premature ovarian insufficiency. We don't want to talk premature menopause because it's very deprivating and making the woman feeling not correct. But yes,
it's hard, right?
it's very hard because the body starts to deteriorate too early. So all the consequences of menopause, which are related to the hormone deficiency, like reduced bone mineral density,
Yes.
risk of cardiovascular disease, risk of cognitive decline, yes, risk of insulin resistance or diabetes, apparently can start earlier.
Everything starts earlier because, as we said earlier, it's nature's birth control. And when nature realizes, or when nature thinks that you're no longer going to be fertile, then you no longer need to have the strong bone structure. You no longer need to have the cardio strength to carry another human being. And then all of these start declining. Is that more or less accurate?
We have to be a little bit against of this, yes.
Yeah.
So I'm much more against of the nature that nature is saying you are no longer needed.
Yeah.
We need for ourselves and we need for the family which we have. So yes, it's a deficiency, but we can fill it up.
Yeah.
We have to think about this, that nothing is happening without the reason, yes, but also we have a tools to fight.
Lifestyle, right? Lifestyle plays a very important role in this.
Lifestyle apparently could be the reason of the early menopause. It's not
really?
only
Also?
genetics, yes.
So could be the reason for early menopause, but could be also the reason of why you would go through menopause at a much healthier experience, right?
It's up to us, really, what is happening in our life. Don't
amazing.
blame anybody else.
So what would be your advice for Alina, for anyone who's listening, of how to, how could you work with your system? So when you're ready to go through into that chapter, what should you strengthen? What should you be working on?
Okay, listen to your body. So watch your periods, because in my opinion, menstruation is a vital sign of woman. So if we go to the doctor and we measure blood pressure, for example, or the pulse, yes, the nurses are doing this every day, is a vital sign, showing if the vitals are good or not.
Right.
For women, in my opinion, the vital sign is a menstrual period. How long it is? Is it painful? Is it long? Do you have period?
Is it regular? Is it
Irregular? Do you have bleeding between the periods? So the period irregularities are because the eggs are talking. So you have to listen to your eggs.
Yeah. And it's unfortunately a topic that most men would feel uncomfortable talking about for some reason. As I said, I've been fortunate being surrounded by women loving, nurturing environment, and it was a
Normal
natural,
thing.
It was a normal thing to talk about. So later on, when I would hear other people thinking, really, like,
How's it possible?
like,
Exactly.
it's for me, it's like, what do you mean? Like,
I don't understand why everyone is like, it's like a taboo thing to
Yeah.
talk about. Like, this is a woman health. This is us. Like, we're walking on this earth,
And
and,
it's-
this is like happening inside of our bodies that actually helps us to reproduce after that.
it's the miracle maker, right?
Exactly.
I mean,
Yeah, okay, we might struggle a little bit sometimes, like out of 30 days of the month, we have like a 3 good ones when we're stable and like happy, ready to leave. But like, why would it be so awkward or again, a taboo thing to talk about? This I never understand.
You need to
Right.
talk. You need to talk to the doctor. And if you find the doctor who say, "Oh, that's normal. Don't worry." Most of women, they have a problem with pain. That's not true.
That's absolutely not
so
normal.
it means you need to find another doctor and dig deeper. And one test which showing, okay, your hormones are fine. What do you want? You have ovarian cyst or you have breast cyst. That's completely normal. It's also not true because that's the sign that something is going on.
Yeah, so I think just like everything else, you need to look at the cause, you need to follow through, and always approach a healthcare professional that is more functional, like yourself, that looks at causes rather than symptoms. And I think one of the main differences, we spoke about this in one of the episodes before, one of the main differences between traditional medicine and more holistic, integrative, functional medicine is that we're not happy with just averages. We want to go to the optimal range. So when the doctor says, oh, it's okay to have a little pain, that's because it's within the average. And average it doesn't mean that you are as healthy as you can be in almost every case. So you need to be optimal. And that is done, according to my information, correct me if I'm wrong, is through regular movement. Exercise is key, muscle is key, reducing stress, making sure your sleep is optimal, and making sure your nutrition, which then affects everything else anyway.
True.
So if you're doing that well, you're most likely your system is functioning well too. Now, I want to just move on quickly before we move to men, because that's also something I'm really interested in. I want to move just to quickly talk about, have tons of friends, clients, etc., that are going through the experience of freezing their eggs. What do you think about that process?
Freeze
and
the eggs.
Do you recommend it, and to what age and all of that?
Well, freeze the eggs as soon as you think about this, because it means that this is in your mind, that eggs might be needed and may be needed in the future.
Okay.
So freeze the eggs, in my opinion, before age of 30, because we're supposed to freeze the eggs when they are young, healthy, and good.
Okay.
So quality and quantity of eggs unfortunately drops very, very significantly. At the age of 40, approximately 20% of eggs are morphologically normal.
Okay.
So if we have, let's say, 10 eggs, only 2 are good. Do we want to freeze the eggs at 40? We should pause to freeze them when they are strong, good morphology. Because if they are good, they can be used in the future.
So you recommend it for people that are not ready to have children now, and maybe they'll have them in the future, in order to make sure that this...
Yeah. That's the option. But does not mean that freezing the eggs and I can do whatever I want in my life. Freeze your eggs and stay healthy.
Yes, yes, of course.
Because you might be pregnant naturally. Maybe you will not need those eggs. Yes.
Right, of course. Yeah, that's great advice.
It's a plan B, but it's not a kind of insurance, but it's not only a solution to rely on later.
Yeah. Okay, great. I think it's amazing advice. It's not a competition, but most people don't know what andropause is. And obviously, the two are different, even though they're based on hormones. But can you just quickly walk us through of what andropause is?
So andropause is a man menopause.
Okay.
But it will not happen as quick as in women.
Okay.
So andropause can take years. And we should inform the men to take care about the health as strong as we now focusing on the menopausal and perimenopausal women. So this is also some subject which should be discussed a little bit louder.
Yeah.
Lifestyle now affects the sperm quantity and quality as bad as the eggs quantity and quality. So do not rely on this that Al Pacino has a children at 89 or 90. Rely on look at your lifestyle, because seeds oil, sleepless night, stress, lots of inflammatory food can very negatively affect the quality and quantity of sperm. What else? We keep forgetting about the heat.
Yes.
How heat exposure, like carrying 2 iPhones in the pocket, taking the laptops on our laps, heating this area which is supposed to stay cold actually, making very bad influence on the sperm count.
Yes.
So the small lifestyle changes can bring the very big and good effect.
And with technology also, you have the electromagnetic field that is
It's
also
another
disrupting
story.
all sorts of things. So it's very much hormonal. And for some reason, andropause is not, most people would most likely listening to this now, they've never heard the word andropause before. Most likely everyone has heard of menopause and know what that is. But for men, it's not something that is widely discussed or covered. And it is because it does affect mood, it does affect your testosterone, which then affects all sorts of other aspects in your body.
Cardiovascular risk, yes. Your
Cardiovascular,
heart
muscle growth, all sorts of things. So the way I deal with my own testosterone and my hormonal levels is I try to go as naturally as possible. I have never done any HRT or TR, nothing against it. And we'll talk about that in a minute to make sure that people understand my point of view and your point of view. I think we share a lot in common with that. But my approach to it is always through natural health, because a lifestyle or something that you do to promote your health is not secular. It's not for a particular area. So I work on my muscles mainly for my general health, for example. So it's less about aesthetics, but more about, so as a 53, 54-year-old man, and I'm a living proof that it's possible to put on muscle at almost any age. And that applies the same for men and women. It's how early you start is perhaps, you have a greater advantage, but you should not give up at any age. And I boost my testosterone through regular workouts, high intensity workouts. I shift weights around. I make sure my diet is healthy. I prioritize, and most people know that I prioritize my sleep. It's super important. And I always work on my stress levels. There is the being in the moment, feeling the flow as much as possible, because we're always bombarded with so much, right? Having the ability to manage that, I think, is one of the key elements for both men and women to manage their hormones. So I think most of this apply to women, correct?
Yes, I'm not against the testosterone therapy in men, and I'm very pro testosterone therapy in women. But I always ask, do you exercise? Do you take proteins? Do you take enough of proteins? Yes, doctor, I have my breakfast 2 eggs and toast. Avocado toast and 2 eggs are the favorite breakfast now.
Yeah.
It's only 13, maybe 15 grams of proteins.
Yes.
Yes. So it's not really enough. So we can raise the testosterone naturally by our lifestyle, food, and exercise, because protein and the exercise will build the testosterone. The more testosterone you have, the more muscle you have. It means longevity is in the muscles.
Yes.
Metabolism is in the muscle. Metabolism is not in the fat.
Exactly. Yeah, it's where the mitochondria lives and all of that. So I supplement, for example, my zinc, and I cycle through that. I'm not always on a zinc supplement. Vitamin D, super important, right? And so many other markers like this.
Magnesium.
Magnesium, I
Yes,
just was about
so
to say that.
important.
Yeah. So for both men and women.
So
So understanding and cycling and being proactive about your health, it will manage so many of the symptoms that both men and women go through as they age in perhaps the best time of their lives, where they're able to properly nurture, to have more time for themselves, to be more experienced. We were speaking earlier about how men switch into a more feminine side, if you like, of their feminine side as they grow a little older, which means they become wiser, they become quieter. And that's why sometimes in relationships, some women prefer older men because of that maturity.
The maturity comes at like what age? 45 in
Yeah,
men.
exactly,
So like
right?
when you're like in my 20s, I need to look for like 40
Yeah,
plus.
yes, exactly, exactly. So let's touch a little bit on HRT and TRT. So your advice, we again talked about that earlier. As I said, I'm not against it, but my own recommendation, I think you support me with this, is that always have it guided. There's a lot of people that do hormone therapies unguided. They don't even test their hormones.
yes.
What is your opinion
So
about
I
that?
always explain to my patient that I have a pyramid in the approach. In the base of the pyramid is a lifestyle. So it means nutrition, sleep, stress, hydration. We didn't touch the subject of hydration, super
Right.
important.
Especially in this region, right?
A second segment is adrenal health. So sleep, stress, breathing, circadian rhythm. So wake up and don't look at your phone. Wake up, open the window or open the curtains and
Exactly.
switch on your cortisol. Don't be afraid about high cortisol in the morning.
Yeah.
It has to be high to push you to work.
Right.
And then switch it off in the evening. So it means cortisol in the evening has to be low,
Reduced.
reduced. Netflix, social media, information, what other people are doing. 3 o'clock in the AM, our cortisol is still high.
Yes.
So second segment is the cortisol and adrenals. Then followed up by thyroid, very important for metabolism,
Right.
gut motility, and also for self-confidence. And on the top of everything is HRT, so the hormones.
Yeah.
So are not on the bottom, they are on the top. It's like the cherry on the cake is a hormonal therapy.
It's not your first line of defense.
not
You
the
need to work
first.
on the foundations, make sure your health
Yes.
style, your lifestyle and your health is as optimal as possible before you go on to something like that. I love that advice.
Don't be afraid of hormonal therapy, because now we have such a beautiful tools in the functional medicine. We have tools to assess the hormones. We have tools to see how the hormones are metabolized in the body, so we can see the metabolites in the urine. So we know if we use them correctly or the hormones are causing DNA damage.
Right.
So don't be afraid, but you have to listen, you have to talk to somebody who knows everything about
and
this.
with the popularity of peptides just exploding everywhere, and that influencing growth hormones and other stuff like that in the body, my go-to that I tell everyone is that, you know, peptides or therapies, they're not magic. They need to be supported with two things. One is lifestyle, and second is guidance from a professional, which then helps you to see the quality of the product that you're using, how often should you be using it for your physiology, not because my friend is using this particular thing that I will apply to me. So I always say, none of it is magic. You have to put in the work in order to get the best result that you could possibly do. Unfortunately, as human beings, we're always looking to the most comfortable, the easiest, or least resistance.
No magic pill.
You get the results that you put in, the effort that you put in.
They are very helpful. They are really great. Ozempic, for example, it's also the peptide.
Absolutely.
So we are using peptides since several years, and they can be the amazing tool to help, but not the base. Yes, it's not the basic tool.
Yeah, so I mean, people don't know that peptides have been around for decades and decades.
Decades, yes.
And they originated in Russia, and then they only became or gained notoriety is during COVID, because people were using them to
The immunity.
for immunity purposes and other stuff like that. And then it became, and as a result, just like everything else, with something that gains and there's possible financial gain from it, like massive financial gains. Now it's available all over the world. It's produced from China to South Africa
Be
to,
careful,
to
yes.
everywhere.
Yes.
And the quality varies greatly. The shelf life varies greatly. The methodology that they use in compound labs varies greatly. So there's a lot of information that we need to be aware of before, using anything like this, especially when it comes to our hormones and for
Agree.
their general health. We look at the label when we buy something from a supermarket, but if someone tells us BPC or tells us CJC or any of the peptides that are super popular at the moment, we just take them, without proper foresight towards them. This has been an amazing discussion. Now, everyone sees that you're using these compression boots.
Yeah.
Now, I think it's your first time that you use them. You use other lymphatic drainage devices,
Yes,
right?
so
What's your opinion of these?
Well, it makes your blood circulation faster.
Yeah,
So I think the brain works better.
yeah.
And also you feel relaxed.
Because you can't move, right? Like it helps you to stay here.
Yeah, yes.
Yeah. So it's one of my favorite things, especially in the evening, to boost circulation. I'm glad you enjoy them.
Thank you very much for
And
inviting
thank you for trying
me. Pleasure
them.
to meet.
And thank you for being here
To be
today. I
here.
appreciate it.
Thank you very much.
Well, guys, thank you so much for joining us this time. I hope you found this useful, and I really look forward to seeing you in the next episode.